Hello everyone. This video will be helpful for you to understand the role and scope of midwifery practices. So we'll understand the topic by role of midwifery, scope of midwifery, legal and ethical issues, nursing practice standards related to maternal and newborn care, ethical components of care standards, ethical issues in maternal and newborn nursing, professional liability issues in maternal and newborn nursing, and code of ethics. First, we'll see the role of midwifery. In general, the role of nurse. The nurse here, in the sense, the midwifery nurse. In general, the role of midwifery nurse can be expressed as providing necessary supervision, care, and advices to women in pregnancy, labor, and postnatal period, promote women's sexual and reproductive health and child health, and facilitates and carries out the audits of maternal and neonatal care, carries out the evidence-based research and further implement it to clinical practice, disseminates information to women and families about safe abortion, contraceptives and spacing, etc. So what are the extended and the expanded role here? Under extended role, a perinatal nurse today may function as a nurturer, educator, physical care provider, critical thinker, support person, counselor, and case manager research. The expanded roles are nurse, nurse practitioner, nurse midwife, certified nurse midwives, and certified midwives. So that's about the role of midwifery. Next, we'll see the scope of midwifery. The basic role of midwife originally was that assisting in delivery process, but now the scope has wider applications and there are many roles of midwife. So what are the scope of midwifery? The scope of midwifery or member obstetric, she can be in the as a member in the obstetrical team, and she can assist in specialized investigation. She can be a counselor, a teacher, and specialized duty and researcher. So first is member of obstetric team. Midwife has to work as a team members in an obstetric department and has to cooperate with the team of members, that is obstetrician, gynecologist, neonatologist, etc. Next is participating in special investigation. The midwife has to learn and assist in the specialized investigations like ultrasonography, amniocentesis, chorionic villus sampling, non-stress test, and contraction stress test. So all this specialized investigations, the midwife has to have knowledge about this, and she should be able to give instructions to the mother who are undergoing these investigations and also carry out the orders given by the obstetricians. And as a counselor, midwife has a scope to utilize her knowledge and opportunity to counsel the mother and her family and clarifying the doubt and solving the problems and giving suggestions. The next scope is midwife as a teacher. Midwife has an opportunity at education sector and guide students by implementing her knowledge at both sides, that is classroom teaching as well as clinical teaching, that is example demonstration of assessment of antenatal mother. The next scope is specialized duties of midwife. She carries some of the specialized duties like providing assistance in treatment and diagnosis, that is, assisting in assisted reproductive techniques. It may be of any techniques like ZIFT, GIFT, and IUI and IVF, etc. The next scope is supportive role. The midwives provide support to family members during pregnancy, labor, and preparing. She makes professional relationship with team members as well as with her subordinates and makes sure she is the best caretaker and best guide. The next scope is multi-sectoral approach. She maintains good relationship with other approaches to the people at the time of any national health programs like RCH program, anemia prophylaxis program, and also motivate people to participate voluntarily in these programs to achieve the national goal. And midwife as a researcher. Midwife has the opportunity and scope in carrying out many research related to her department so that her findings can be utilized for further information. Example, sitz bath for episiotomy patient, an application of cabbage leaves which inhibits the milk production. The next scope is midwife as administrator. If a midwife gets chance to be an administrator, she can put forth and accept the duties of administration at institution or at clinical sector could be done. Independent midwife practitioner. Midwife has scope to become an independent midwife practitioner to make diagnosis as well as decisions that are based on knowledge, skills, and experience. She also recognizes deviations from normal and provide treatment for those deviations. Legal and ethical issues. As professionals, nurses are both legally and ethically accountable for the nursing care. Care of pregnant women and their newborn requires special knowledge, communication, and teamwork among healthcare workers. Ethical issues and concerns have multiplied with the increased use of technology and scientific advancements. Now we'll see about these nursing practice standards related to maternal and newborn care. Standard 1, quality of care. The nurse systematically evaluates the quality and effectiveness of nursing practice. Standard 2, performance appraisal. The nurse evaluates his or her own nursing practice in relation to professional practice standards and relevant statutes and regulations. Standard 3, education. The nurse acquires and maintains current knowledge in nursing practice. Standard 4, collegiality. The nurse contributes to the professional development of peers, colleagues, and others. Standard 5, ethics. The nurse decisions and actions on behalf of her patients are determined in an ethical manner. Standard 6, collaboration. Nurse collaborates with patient, significant others, and healthcare providers in providing patient care. Standard 7, research. The nurse uses research findings in practice. Standard 9, practice environment. The nurse contributes to the environment of delivery care within the practice setting. Standard 10, accountability. The nurse is professionally and legally accountable for his or her own practice. The professional registered nurse may delegate to and supervise qualified personnel who provide patient care. So these are some of the standards related to maternal and newborn nursing. Next is the ethical components of care standards. The standards of care are based on a legal model rather than on ethics. The law is based primarily on a rights model that establish rules of conduct to define relationship among individuals. The next topic is ethical issues in maternal and newborn nursing. Ethics involve determining the best course of action, what is morally right and reasonable in the given situation. Ethical issues have become more complex with advanced technology which allow families the more options. Complex ethical questions are related to maternal versus fetal rights. Widely varying standards of viability, abortion, mandated contraception, use of fetal tissue for research, length of time, how much resuscitation should be continued, and cord blood banking, and the use and protection of genetic informations. The next is about the professional liability issues in maternal and newborn nursing. Nurses are legally responsible and accountable for the quality of nursing care they give. They may also be held accountable for care given by other team members of the healthcare team. Accurate assessment of data and careful documentation are essential in protecting the nurse and justifying the course of action. Crucial areas of concerns are establishing who may give the consent for health care, providing care of the fetus, and care for clients not of legal age. The nurse are legally responsible for reporting the following: suspected case of child abuse, inappropriate or incomplete care provided by the other healthcare workers, and professional impaired by substance abuse. Malpractice claims against both physicians and nurses have escalated during the past few years. Perinatal nursing is the area in which most lawsuits occur. The most common problems occurring at birth or slowly after the prematurity or slowly after that or prematurity, low birth weight, congenital anomalies, respiratory distress syndrome. These are the tragic moments for the parents and they may look for someone to blame. To avoid malpractice claims, nurses are expected to provide care within the context of Nursing Practice Acts, policies developed by the agencies in which they practice. And documentation is essential for protecting the nurse and justifying her action. Next, we'll see about the code of ethics. The nurse midwifery exists for the welfare of the women and their families. Nurse midwife uphold the belief that childbearing and maturation are normal life processes. Decisions regarding nurse midwifery care require client participation in an ongoing negotiation process in order to develop a safe plan of care. Nurse midwives share professional information with their clients that leads to informed participation and consent. Nurse midwife practice competently. They consult and refer when indicated by their professional scope of practice and or personal limitations. Nurse midwife provide care without discrimination based on race, religion, lifestyle, sexual orientation, socioeconomic status, or nature of health program and health problem. So the nurse midwife should provide care irrespective of their race, religion, and etc. The nurse midwives maintain confidentiality except when there is clear, serious, and immediate danger or when mandated by law. The nurse midwife take appropriate action to protect the client from harm when endangered by incompetent or unethical practices. Nurse midwives interact respectfully with the people with whom they work and practice. Nurse midwives participate in developing and improving the care of women and their families through supporting the profession of nurse midwifery, research, and the education of nurse midwifery students and nurse midwives. The nurse midwife promote community, state, and national efforts such as public education legislation to ensure access to the quality of care and to meet the health needs of women and their families. So I hope you gained some knowledge regarding the topic, the role and scope of midwifery practices. In this video, we saw about the role of midwifery, the scope of midwiferys, and the professional liabilities of the maternal and the nursing care, and the code of ethics for the nurses, and also the legal and ethical issues in the maternal and newborn and nursing. So, thank you all.